Welcome to this AI debate on should governments ban hard drugs or legalize them, where chatbots explore both sides. We'll begin with opening statements from Ban Hard Drugs and Legalize and Regulate. Now, ban hard drugs.
What would you choose? More children growing up in safe neighborhoods, or more dangerous substances sold on every corner with the government's blessing? I ask that because the choice before us is not abstract, it is practical and moral. I stand for banning the manufacture, sale, and possession of hard drugs because prohibition best protects public health by limiting exposure to substances that produce high rates of addiction, lethal overdoses, and long-term social harm. Evidence indicates that nations facing surges in synthetic opioid availability see rapid rises in fatal overdoses, a pattern that prohibition seeks to prevent by keeping those substances out of general circulation. Keeping powerful and unpredictable drugs off the open market reduces the number of people who encounter them in the first place, and fewer encounters mean fewer new addictions and fewer preventable deaths. We must also keep children and communities safe. When hard drugs are illegal, there are clearer barriers, legal, social, and commercial, between young people and the supply chains that bring those drugs into neighborhoods. Prevention programs and early intervention reduce the likelihood that adolescents will experiment and spiral into dependence. An investment in such programs is part of a prohibitionist strategy that focuses on stopping harm before it begins. Sending a message that the state will not endorse or normalize substances whose primary effect is to hijack developing brains matters. Children learn from what is permitted and marketed, and prohibition helps keep dangerous products from being packaged, advertised, and dispersed where young people live and learn. A focused ban, enforced primarily against producers, traffickers, and suppliers, is smart public policy. Organized criminal networks profit from open markets for hard drugs. Interrupting manufacture and export reduces the revenue streams that finance violence, corruption, and other criminal enterprises. International and domestic enforcement aimed at supply chains, combined with intelligence-led disruption, undermines the business model of violent traffickers and raises the costs and risks of running a drug syndicate. That does not mean we should punish users harshly. Rather, prohibition must be strategic, target the suppliers who profit while treating users through health-centered pathways that reduce demand. Regulation works for some goods because dose and purity are predictable. Hard drugs are different. Many of these substances are extremely potent, and small variations in dose or purity can produce mass harm among inexperienced or returning users. The rapid spread of illicitly manufactured fentanyl and its analogs shows how quickly potency can make a market lethal, producing unpredictable overdoses even among those who think they know what they are taking. You cannot reliably calibrate safe retail rules, age limits, or quality control for substances whose margin between an active dose and a fatal one is so narrow. Prohibition minimizes the chances of large-scale accidental poisonings and sudden surges in deaths by keeping the most dangerous substances off regulated shelves. Beyond immediate physical harms, governments have a moral duty to reduce predictable social damage. Addiction undermines autonomy, strains families, and corrodes civic participation. Allowing easier access to highly addictive drugs shifts the balance toward preventable dependency and fragmentation. A society that tolerates the commercial sale of goods that regularly destroy lives abandons a basic civic obligation to protect its citizens from foreseeable, severe harm. Prohibition is an expression of that obligation, not a denial of liberty. It is a collective decision to limit availability of a class of products whose predictable effects are grossly harmful to individuals and to social bonds. I do not deny that prohibition must be paired with compassionate, effective policies. Place stricter penalties where they deter distribution, not to criminalize illness, and expand treatment and rehabilitation capacity so that users are diverted into care rather than punishment. Invest in prevention curricula, family supports, and community services that demonstrably reduce youth initiation. Strengthen international cooperation to interdict precursors and dismantle transnational manufacturing. Focus law enforcement on suppliers and traffickers while offering health-first responses at the point of contact for users. Finally, let us answer the anticipated argument that legalization would reduce crime and free up public health systems. The evidence warns that widespread legal availability of highly potent drugs would increase exposure, raise use rates, and shift production into licensed industries that could quickly scale for export, thereby increasing global supply and paradoxically fueling criminal innovation elsewhere. Prohibition, properly enforced and coupled with prevention and treatment, reduces the customer base that makes trafficking lucrative and guards against mass exposure to substances whose potency makes regulation a dangerous gamble. Choosing prohibition for hard drugs is public-spirited. It prioritizes preventable safety, protects children and neighborhoods, interrupts the business model of violent traffickers, and fulfills government's moral responsibility to reduce grossly harmful behavior.
Now, legalize and regulate.
We cannot arrest our way out of addiction, a public health leader observed when describing why punishment alone has failed. That tension lies at the heart of this debate. I will argue that governments should legalize and tightly regulate hard drugs because a regulated model better protects lives, shrinks the violent criminal market, frees up public safety capacity, reduces unjust incarceration, and finances the prevention and treatment systems we actually need. First, consider the market dynamics that drive violence. Prohibition hands a closed, highly profitable industry to organized crime, creating monopoly rents that are defended with weapons and secrecy. Evidence indicates that when markets are brought into the open and profit margins are removed or reduced through legal supply, those incentives for armed dispute and turf conflict fall sharply. That matters because community safety and homicide prevention are central government responsibilities, and because broken drug markets fuel a wider spiral of gang-related harm. Second, regulating supply allows governments to mandate quality controls, potency limits, and on-site drug checking, which directly reduce overdose risk. The current epidemic of fatal overdoses is driven in large part by unpredictable, highly potent adulterants such as illicitly manufactured fentanyl. Making legal, tested products available and enabling consumers to verify contents prevents accidental ingestion of deadly mixtures. Third, supervised consumption and safe supply interventions provide concrete examples of harm reduction in action. Supervised sites reduce fatal overdoses at the local level, connect people to services, and lower public disorder without increasing community-level drug use. These are evidence-based outcomes from multiple reviews of supervised injection services. Fourth, Portugal's experience shows that shifting away from criminal sanctions toward regulated health responses can produce measurable public health gains without catastrophic increases in use. Their policies reduced burdens on the criminal justice system while expanding treatment access and lowering problematic use indicators. Fifth, punitive enforcement has not been applied evenly. Drug laws have produced stark racial and socioeconomic disparities in arrests and long-term consequences. Ending criminal penalties for possession and creating legal pathways, combined with record-clearing mechanisms, directly addresses those injustices while focusing enforcement on serious organized trafficking rather than people with substance use disorders. Sixth, legalization is not a blank check. It can be an important revenue source earmarked for public health priorities. Regulated sales generate taxes and fees that can fund prevention campaigns, low-threshold treatment, housing supports, and naloxone distribution, turning a previously clandestine market into a sustainable public good funding stream, as demonstrated by state-level cannabis taxation regimes that allocate revenue to health and education programs. Now, let me be clear about the regulatory design I am proposing. Tight licensing for producers and distributors, strict age limits and identity verification, bans on youth-targeted advertising, enforceable potency caps, plain packaging and tamper-resistant containers, mandatory on-site testing and standardized labeling, robust monitoring and surveillance of health outcomes, and supervised consumption spaces and safe supply pilots where clinical risk warrants. These elements are intended to prevent commercialization that targets vulnerable groups, limit accidental overdoses, and maintain tight state control over supply chains. Critics will warn of normalization and higher prevalence. That risk is real. which is why legalization must be combined with strong demand reduction measures. Evidence-based school and community education, accessible treatment, including medication-assisted therapies, low-threshold diversion programs, and ongoing evaluation with the power to tighten rules if use patterns change unfavorably. The experience of jurisdictions that have decriminalized or regulated parts of the drug market shows that outcomes hinge on policy design. Good regulation reduces harms, while laissez-faire approaches create new problems. Opponents also claim that legalization will simply expand use among young people. We can and should respond with age restrictions, plain packaging, advertising bans, and penalties aimed at sellers who breach those protections. Tools that have worked to shield youth from tobacco and alcohol marketing when properly enforced. Moreover, criminal penalties themselves have not been an effective deterrent and have produced collateral harm that undermines long-term prevention goals. Finally, legalization allows law enforcement to reallocate resources from chasing low-level possession to targeting violent organized networks, human trafficking, and other crimes that communities demand be addressed. That reallocation improves public safety in ways Prohibition has consistently failed to deliver. Treating drug use primarily as a public health problem is not indulgence. It is a pragmatic, evidence-driven strategy to reduce preventable deaths, violence, and social harm while directing resources where they save lives. This approach requires disciplined, accountable regulation, not laissez-faire markets, and it demands transparent monitoring, independent evaluation, and the political will to adjust course when evidence indicates. For the sake of public safety, racial justice, and the many lives affected by addiction, legalization, paired with tight regulation, is the responsible path forward.
Now let's hear the first rebuttals from Ban Hard Drugs and Legalize and Regulate. Now, ban hard drugs.
You make a persuasive case for harm reduction, and I agree on the narrow point that supervised consumption sites and diversion to treatment save lives and deserve support. Those are necessary tools. They are not, however, an argument for legalizing the manufacture, sale, and broad possession of hard drugs. Bringing supply fully into the open transforms the policy question. Right now, your strategy treats supply as a technical problem. License it, test it, tax it, and assumes markets will behave like regulated alcohol or pharmaceuticals. That assumption ignores the distinctive biology and market dynamics of highly addictive, often lethal substances. When a product hijacks reward circuits and creates rapid physiological dependence, small increases in availability can produce large increases in initiation, chronic use, and social harm. Normalizing retail access signals safety to young people and lowers the barriers to casual experimentation. We cannot discount the developmental vulnerability of adolescent brains. Second, your claim that legalization will shrink violent organized crime is too selective. Yes, eliminating a black market can reduce some street violence, but it also creates new incentives to scale production and export. A legal domestic industry that manufactures high-margin opioids will attract actors who seek profit across borders and channels. Absent airtight export bans and international enforcement mechanisms, details you have not credibly specified, that same capital and capacity can redeploy into illicit trade or push syndicates into trafficking other harmful goods. Third, quality control and testing help with some adulteration risks, but they are not a fail-safe against rapidly emerging hyperpotent analogs or accidental cross-contamination. Regulatory systems routinely lag market innovation. A regulatory regime that cannot keep pace risks mass exposure to new harms. Fourth, examples like targeted treatment-first reforms and supervised sites demonstrate harm reduction works alongside prohibition, not because prohibition fails entirely. We should preserve prohibition's preventive barrier while scaling the health services that reduce deaths and connect people to recovery. Practically, that means focused enforcement that targets suppliers and chemical production, strict penalties calibrated to deter distribution with diversion to treatment for users, large investments in prevention and evidence-based education that reduce initiation, expansion of treatment capacity, including medication-assisted therapies, and sustained international cooperation to disrupt supply chains. If legalization proponents want to argue otherwise, they must produce measurable, enforceable commitments. explicit export prohibitions backed by treaty-level mechanisms, concrete potency caps with rapid response enforcement, and demonstrated plans to prevent youth-targeted marketing. Without those, legalization risks normalizing highly hazardous substances, increasing demand, and overwhelming public health systems. We can meet the moral and public health goals you cite, but we can do it while keeping dangerous products off the open market and protecting children and communities from mass exposure.
Now legalize and regulate.
I agree with the core instincts in the other side's case. We should protect children, and we should fear unpredictable lethal potency. Those instincts are right, and they point away from prohibition, not toward it. Prohibition hands a chaotic, unregulated market the very features the opponent fears. No age checks, no lab testing, no accountability, and enormous profit incentives for adulteration and secrecy. That's why a regulated, tightly controlled system is the safer, more pragmatic choice. On youth protection, consider the difference between an underground supply chain and a licensed retail system. Licensing creates enforceable age limits, plain packaging and advertising bans, heavy penalties for diversion, and traceability from producer to point of sale. Those are concrete, enforceable tools. An illicit market offers none. Saying keep it illegal to protect kids is asking us to rely on secrecy and hope. A regulated framework replaces hope with controls that are actually proven in other regulated sectors to limit youth access. About potency and overdoses, the risk isn't solved by making drugs harder to find, it's exacerbated. When buyers cannot test products or know dose impurity, adulteration becomes common and deadly. Legalization allows mandatory laboratory testing, standardized dosing, potency limits, tamper-resistant packaging, and retail screening. It permits supervised consumption and safe supply programs where people can use under medical supervision and get immediate overdose reversal. Those measures reduce accidental poisonings in ways prohibition never can. On crime and violence, prohibition concentrates market power in clandestine organizations that protect profit through violence. A regulated supply breaks that monopoly by providing a lawful alternative that undercuts illegal profits. That lets law enforcement focus on violent crime and trafficking networks rather than arresting users and small-scale sellers, a shift that both reduces harm and improves public safety priorities. The moral argument matters. Addiction ruins lives, and criminal records make recovery harder. Treating drug use primarily as a health issue, with accessible treatment, housing supports, and evidence-based prevention funded by taxes on legal sales, is the humane route that reduces long-term social damage. Will regulation increase use? Any legal framework must be designed to limit normalization. Tight age limits, advertising bans, vertical integration limits, phased rollouts, and taxes earmarked for prevention and treatment. Those controls, combined with supervised consumption and outreach, balance individual autonomy with collective protection. If our goal is fewer deaths, fewer violent markets, and better paths to recovery, legalization with strict, public health-focused regulation is the pragmatic choice. Prohibition may intend to protect, but in practice it removes every tool we need to keep people, especially young people, safer and alive.
Moving on to the second rebuttals. Now ban hard drugs.
I agree with the humane instincts behind their case. Saving lives, prioritizing treatment, and protecting children are essential goals. I also accept the narrow wins they point to. Supervised consumption, safe supply pilots, and diversion to treatment reduce immediate harm and deserve support. But those are bridge measures, not blueprints for creating a mass commercial market for substances that fundamentally hijack brains. Imagine two policy choices. One narrows exposure and treats addiction as a health crisis. The other opens storefronts for products that produce rapid physiological dependence. Which do we think will leave more children and communities intact? The answer is not abstract. First, legalization trades secrecy for scale. Yes, a licensed system can impose age checks and testing, but scale creates new incentives. A lawful domestic industry that can profit from high-margin opioids will naturally seek growth, including exports or diversion to illicit channels, unless you can produce airtight, enforceable international restrictions. Can they describe the treaty-level export ban they would use, who enforces it, and what penalties would deter transnational actors? Second, Testing and labeling help in a narrow sense, but regulatory systems routinely lag market innovation. When hyperpotent analogs emerge, small lapses in identification, cross-contamination in production, or delayed regulatory responses can produce mass harm very quickly. Relying on regulators to outpace chemistry and profit-seeking actors is optimistic. Precaution is prudent. Third, we must not confuse reducing street violence with eliminating criminal networks' incentives. Under a regulated model, some street-level violence may drop, but the underlying capital, distribution know-how, and appetite for profit do not vanish. Those resources will be redeployed unless explicitly constrained. Who will stop sophisticated networks from shifting to export markets, cyber-enabled distribution, or other illicit trades? Fourth, normalization matters. Markets teach norms. Retail outlets, packaging, and ordinary transactions signal acceptability to young people whose developing brains are uniquely vulnerable to addiction. We can design strict marketing bans and vertical integration limits, but the safest policy avoids the signal entirely. Practically, we can meet their goals without legalizing supply, focus enforcement on suppliers and production facilities, invest heavily in prevention and evidence-based education that lowers initiation, expand treatment capacity, including medication-assisted therapies and housing supports, scale supervised sites and diversion programs to save lives now, and deepen international cooperation to choke supply chains. I welcome regulation that saves lives, but I insist on three things before anyone proposes legalization: concrete, verifiable export prohibitions with enforcement mechanisms, clear, enforceable potency limits and rapid response regulatory authority, and rigorous, long-term population-level data showing legalization reduces youth initiation and net harms. If they cannot supply those commitments, the safer course, for children, for public health, and for communities, is to keep manufacture, sale, and possession of hard drugs prohibited, while building the robust health services and targeted enforcement that actually reduce death and addiction. In my closing, I will show how that calibrated strategy delivers the harm reduction outcomes they seek without normalizing highly dangerous substances.
Now, legalize and regulate.
I'll grant their strongest instincts. Protecting children and preventing unpredictable, lethal drugs are moral imperatives. But those instincts are precisely why prohibition fails. If our aim is fewer deaths and safer communities, we have to ask which system actually gives us tools we can use, not hopes we cannot enforce. Prohibition relies on secrecy and absence of accountability. A tightly regulated legal market gives us enforceable age checks, traceability, mandatory laboratory testing, potency limits, tamper-resistant packaging, and criminal penalties targeted at sellers who break the rules. Which of those two systems sounds likelier to stop a teenager from getting a lethal pill or a fentanyl-laced dose? The answer matters. They worried that making supply legal will normalize use and spark larger markets because addictive substances can hijack brains. I agree that biology matters, and that's why regulation must be constructed to resist normalization. Strict age limits, plain packaging and advertising bans, heavy fines and license revocations for diversion, limits on retail density, phased rollouts, and taxes earmarked exclusively for prevention and treatment. Those measures are designed to keep exposure low while making use safer for the people who will use regardless of legality. They also argued legalization will simply reconfigure organized crime rather than reduce violence. But refusing to offer a lawful, quality-controlled alternative hands monopoly profits to clandestine actors. Undercutting demand through a legal, regulated supply reduces the black market premium that drives violence. At the same time, focused law enforcement should target large suppliers, importers, and violent actors, not small users, freeing public safety to go after real threats. They raise the valid point that regulation can lag innovation and that new analogs can outpace oversight. That risk is real, so the regulatory design must include rapid response monitoring, mandatory reporting of adverse events, flexible scheduling powers, and investment in drug-checking infrastructure and supervised consumption capacity so frontline providers can detect and respond quickly. Finally, the moral question: do we punish addiction or treat it? Criminal records and incarceration worsen long-term outcomes and obstruct recovery. Treatment, housing, harm reduction, and social supports improve them. If our standard is reducing harm, we should measure outcomes, overdose deaths, youth initiation rates, violent crime, and incarceration disparities, and choose the system that lowers those metrics. In my closing, I will show how a phased, tightly constrained legalization program with strong enforcement against diversion, built-in public health financing, and real-time monitoring delivers better, measurable results than the status quo. Which path better protects our children and communities? A hidden market with no controls, or a regulated system that replaces chaos with concrete, enforceable tools? The choice should be obvious.
Finally, the closing statements from both sides. Now, ban hard drugs.
Ask yourself what victory looks like. Fewer children exposed, fewer families shattered, fewer bodies in emergency rooms. That is the choice before us. Prohibition is not an empty moral posture. It is the policy that most directly reduces exposure to drugs that cause rapid addiction, lethal overdoses, and long-term social decay. I concede the humane case for harm reduction tools. Supervised consumption, safe diversion to treatment, and naloxone save lives and must be funded. Those tools, however, do not justify legalizing the manufacture and sale of the most dangerous substances. Legalization would normalize supply, widen availability, and invite commercial incentives to expand production and export. It would shift costs to our hospitals, schools, and neighborhoods. A better path is targeted enforcement against suppliers, robust prevention and education, expanded treatment and rehabilitation, and international cooperation to choke supply chains, with penalties focused on distributors while treating users as patients, not criminals. That combination protects public health, defends children, and breaks the economic power of organized crime. If our duty is to protect the vulnerable, prohibition, wisely enforced and humanely implemented, is the right course.
Now, legalize and regulate.
Ask yourself which policy truly protects children and neighborhoods: criminal markets that hide poison and fund violence, or a regulated system that puts safety checks, limits, and care where they belong. Prohibition promises control but delivers chaos. Regulation delivers tools. A tightly controlled legal market can eliminate deadly impurities, impose potency caps and child-proof packaging, ban advertising, enforce age limits, and fund prevention and treatment with tax revenue. It lets police focus on violent offenders, shrinks incarceration and its racial harms, and creates supervised consumption and safe supply programs that save lives now. I hear their worry about normalization. I share it, which is why I advocate a phased rollout, strict licensing, education, and robust evaluation to prevent youth access and curb use. This is not a soft answer. It is pragmatic responsibility. If our aim is fewer deaths, less violence, and more recovery, choosing regulation over prohibition is the morally and practically superior path.